Okay. All right. So, welcome, friends, colleagues, students, citizens of the world. This is your boy, LeRoy Horton, coming back to you with another episode of the Teach Me Implants podcast. And I got a super special guest with me today. As promised, I only bring you the best of the best. I've got my good friend and now co-worker at PNWU, as she is an adjunct associate professor, Dr. Susie Bergman. Susie, how you doing?
I'm good. How are you, Leroy?
I am excellent now that we figured out all these technical difficulties and I'm finally seeing your face in 4K and your beautiful smile. So tell me or tell the audience a little bit about yourself, your credentials, your resume in less than a minute.
Okay, great. So I'm Susie Bergman. I am a general dentist who actually focuses on temporomandibular disorders and orofacial pain. I kind of dabble in ortho as my hobby these days. I started out mostly treating kids and doing pedo for the first 15 years or so of my practice. Um, but as fate would have it, I started to get more involved in TMD, treatment management, advocacy, and research because I'm also a TMD patient.
Okay, okay. So that's a pretty extensive resume. So we've got a big dog stomping with us today. So I feel the privilege and the pleasure. One of the things I really wanted to bring you on about is I tend to be a little active on LinkedIn, so I'll drop some commentary here and there, and sometimes it can spark a little debate. But I was really happy when you gave me a little support, and I was like, yes, I know I'm not the only one. So to give everybody a kind of the context of what happened, there's a hygiene shortage, right? Staffing
Right.
shortage in general. And I'll put up a graphic for everyone to see here. Okay, so you can see what I'm seeing here.
Yes.
All right, so
Perfect.
the Health Policy Institute put out some information, and the ADA on their website kind of did a synopsis, and they found that about 62% of practices in 2025 are going to be experiencing staffing shortages, right? When you go back to 2022 to 2024, you see that those numbers of dentists claiming or reporting that finding staff is either challenging or extremely challenging varies anywhere from 70 to 90%. So you can imagine the amounts of angst that our practitioners are experiencing. And I know you're in practice down, is it kind of close to the border of Oregon and Washington?
Mhm.
Have you seen that transition over the years where we had stability for what seemed like forever, and then all of a sudden it's like you can't find anybody?
Yes, I definitely saw that. I blame the COVID pandemic.
Mm.
We had hygienists who had been with us for over a decade that just decided, hey, I don't really want to do this. It doesn't feel safe anymore. And then we just went through the revolving door of hygienists for a couple years. I think a lot of people are just reevaluating what they want to do in the profession, or, some of them might have been burnout or just decided that their work-life balance needed to change, but there definitely has been a shift.
Absolutely. And it's typically when those shifts and transitions happen when certain parties get squeezed, right? That's all it usually takes. It's one of a few members of the team, and it's usually the member that has the greater financial responsibility of ownership and liability to making sure that payroll's going and the lights are on. When that entity gets squeezed, there tends to be a lot of infighting,
Yeah.
right?
Yeah.
And one of the things that I've seen recently is states that are seeing the greatest shortages are resorting to different tactics to try and keep up with the demand of care. So I know in Washington, they are passing, I can't remember how far into the legislature it got, but allowing assistants to do supragingival scaling is one of the
Hmm.
things that's controversial.
Hmm. Hmm.
In other states, I think we were on the LinkedIn debate around coronal polishing in DC.
Right.
And for anyone that may not be privy to it, different states may have different scopes of practices and job duties that a certain position is allowed to do. I was kind of taken aback at the level of vitriol that existed over the notion of coronal polishing in DC, given what we allow our assistants to do here. Did you have that same reaction? Were you like, wait, are we talking
Yeah.
about coronal polishing or what?
Well,
How did you
yeah,
see that?
so I went to dental school in West Virginia. So I grew up on the East Coast, and when I moved to the West Coast, I noticed that we are much more progressive over here. Um, but honestly, we're talking about a little prophy cup. And um, I think it sounded more like a turf war to me than an actual conversation about whether or not someone should be allowed to polish. At least that's what my impression was that um, there are things that assistants have been doing, like you said, here in Washington State for years and years. And I taught assistants for 10 years. So I've taught them all over the country. And I know that every area of the country has a little bit of a different philosophy on what should be delegated and what should be kept for the person with the license.
And that's not just assistants, right? I know in some states hygienists can't give anesthetic,
Right.
right? Whereas here they can give anesthetic or they can have a restorative augmentation to their license so they can actually, with that extra training, if we drill the tooth, they can then fill the tooth. And so I wanted to share with you what assistants can do in our state. And the
Hmm.
list, if you can see this, is huge. They can do x-rays, unlike in California where you have to get an extra x-ray certification. They can apply sealants. They can polish teeth. They can apply tooth separators. They can take impressions or digital scans for temporary prostheses. Um, they can cement temporary crowns. They can clean off the extra cement from a temporary crown. They can bond attachments. They can remove arch wires. They can fit and adjust headgear. This is from the our state of Washington WACs. So
Hmm.
this is a highly trained assistant is a very high commodity in our state anyway.
Absolutely. I 100% agree. So I taught ortho assistants specifically. And I think I shared with you a video that I did where I said, assistants are excited to help their doctor and they get tired of sitting there with the suction all day long. So give them tasks that they are more than capable of doing, train them well, make sure that they understand protocol, and make sure that you feel confident with your assistant, and then let them help. We all need help, right?
Right. And it's invigorating, like you said, if you're doing the same thing day in, day out and you're just holding suction, it'll be mundane. You'll lose the excitement, you'll lose the enthusiasm, and you may not stick around long enough to be great because it's not stimulating to you. But when you can all of a sudden assist in restorative, in perio, when you can do sealants, when you can prophy, as controversial as that seems to be in some parts of the country, it's in the same way that hygienists want to add some variety to their scope of practice and their daily routine. It just seemed like an odd battle to be fought at the level of energy that existed in that communication. And what happens is, and I guess I should preface because I will defend the hygienists in this regard. In the state of Washington, you can walk off the street and be a dental assistant. All you got to do is pay a registration to the state online. Boom, within a week, you're a registered dental assistant. So I will admit that there is room for untrained people to do things. That whole list that I show you, technically an
Right.
untrained person could do it. However, and I'll go back to these graphics, I remember when I first graduated, I worked part time at Clover Park Technical College. And one thing that I loved about this technical college is they had still have a dental assisting program. It was a 5 quarter program, so it was more than a year of training.
Hmm.
And this is the list off their website of all the different didactics and hand skills that they get. They get trained not only on hand side and chair side, They get trained in certain lab procedures. They get trained on office software, right?
Hmm.
Dentrix, Open Dental. And there's a computer literacy component at Clover Park where they have to know how to use Word and Excel and PowerPoint to some degree. Hands down, one of the best programs. They had an in-house clinic, which is that was part of my job there, is to see actual patients in their in-house clinic. And they would have to do that for 3 months. Then they would do a 3 month external rotation at a
Yes.
partnered office.
Hmm.
Then they
Hmm.
would be able to graduate and be a registered or a registered dental assistant with the credential of having finished their course,
Expanded functions.
right? And this was just a general assistant course. That
Oh,
everything I just said there wasn't even the expanded function,
oh,
right? So
okay.
that's for anyone listening. If you've worked a number of years, you can go back and do accelerated training. So you can also do restorative treatment as a hygienist can, where if me and Susie drill the tooth, the assistant can fill it and we can leave the room. So it helps us increase production. So what are your thoughts? Because I'm assuming you, like me, have also trained people off the street.
Hmm.
And in fact, some of the best assistants I've had to train them with no formal training from an actual school. What's your
Hmm.
experience with that been?
Okay, so my very first assistant, she went through medical assisting, not dental assisting. And when we hired her, I was an associate at the time. She didn't know anything, but this is a tooth, right? And she turned out to be an amazing assistant because she was interested and she wanted to learn, and it was stimulating for her. But I've had so many different types of assistants. I've had some that are at the end of their career. I've had some who decided, this isn't for me. And I think really the important thing is to understand that just like in dental school, they would say, like, this student has really good hands, or this student is good at theory. So the assistants that we're going to train and allow to do clinical techniques and to work inside a patient's mouth have to be able to do that. They have to have good manual dexterity, good vision, all of those things. And there are some who will make incredible assistants. We have one in our office who took that training you were discussing. She was the only assistant in the course at the time. The rest of them were all hygienists. And I think she did better than anyone in her class because she just wanted it very badly and she worked hard. She told me she was there all day Saturday and all day Sunday for I don't know how many weeks the program was. Did treatment on live patients and took a board exam. And I think that might have been what the hygienists in the LinkedIn conversation were upset about. Um, I think because they went to school, you know, and my personal opinion is always, always do what only you can do in your practice. The doctor shouldn't be sitting there, like for me, I do a lot of ortho, so the doctor shouldn't be sitting there tracing the stuff and setting the room up and taking the wires out. The assistant can do all of that for them. I should be doing the things that only I can do. And same with the hygienist. If I don't want my assistant to do, scaling and root planing, of
Right,
course, I want the hygienist to do that. And
right.
and in our state, I think it's very clear that hygienists like to have help. Well, I've
Yes.
never had a hygienist complain when somebody said, "Let me come in and take this for you so you can get started with your next patient."
Never. I mean, we have, whether you're running a traditional schedule or an accelerated schedule where you have one or two multiple assistants helping a hygienist or multiple hygienists to see more patients, they've always wanted help because it's
Hmm.
not just help taking x-rays, it's not just help polishing and potentially doing the oral hygiene instruction. It might be help turning over rooms, doing
Hmm.
sterilization. It's a team effort, right?
Right.
It's absolutely a
Right.
team effort. But on a scale of 1 to 10, Because if this fight was over, say, scaling,
Hmm.
I might understand the energy level we were perceiving. But on a scale of 1 to 10, how technique sensitive, how potentially dangerous, how much skill do you need to do coronal polishing? Just the coronal polishing. Is this something that deserves this type of anger in DC?
No, I don't think it deserves that. I mean, on a scale of 1 to 10, are you asking how difficult that?
Yeah,
Yeah, I don't want to offend anyone, but I would say that's a one, you
right,
know?
right,
Yeah, I will tell you, like I went to Egypt. My family's from Egypt, and I went there one time to do some charity dental work, and I taught my cousin to do things to help me because I didn't have anybody else. And you can teach someone to polish with, I believe, without harming a patient. If we're talking about something like using a high-speed handpiece and, cutting tissue, that's completely different. But a little bit of prophy paste, a little bit of pressure on the teeth, make sure that there's no plaque left behind. That's what we're
right,
talking about, right?
right. I mean, it's a glorified toothbrush. I
Right.
mean, right,
Right. It's a toothbrush that makes a lot of noise.
right. But let's play devil's advocate because we got to be fair to all parties, and I'm just as critical of my dentist colleagues as I am of anyone else in this profession. If you were to make this claim or to try and push this initiative to allow assistants in Washington to do just super gingival scaling, so just above the gums, if you see anything, you can flick it off. I guess my suspicious ears would hear that and say, well, how many dentists are going to use that and then call that prophy? Because I've traveled from office to office, and I was associate before I was an owner for a couple years, and I saw a lot of corner cutting. And we know that there's a monetary incentive to seeing more patients and to having less overhead,
Mhm.
right? And I could see how someone would say, "Oh, okay, well, do I even need a hygienist? Because I'll just have my assistant go like this. I'll pop in the room. Everything is good. Go ahead and polish. You're good to go." Does that do, does adding to the scope of practice of lower level providers like assistants compared to hygienists and doctors, does it open up this potential floodgates of doctors abusing that, knowing that the patient may not know any better?
Mhm.
What are your thoughts on that?
My thoughts would be um, most dentists went into the profession because we want to help people, but some dentists, unfortunately, look at their look at their bottom line, and that's what drives them. So I think I wouldn't be able to put my head on my pillow at night if I had taken advantage of my patients or gave them less than what they expected and deserved.
Right.
Um, I think it's more of the character of the practice owner, the character of the dentist, and their willingness to take advantage of a situation, more so than whether or not this should be allowed. If if we only did things where people were doing like where people couldn't cut corners, we would have to have the dentist do everything,
Right. And then
right?
someone watching him to make or her to make sure they're doing everything.
And that was dental school, right? We went to
Right.
dental school. We should be past that.
Yes. So in my capacity now, especially as a periodontist, I've been at a couple offices where I've seen practices that I felt were substandard to a degree, less than ideal. And usually when I talk to the doctors, they're very open. I say, "Hey, let me do a lunch and learn with your hygienist. because most practices are not measuring clinical attachment loss in approximately, which is kind of the standard of care, especially for periodontal patients. They go straight probing and mid-facial recession, and that's it. Most offices, right? Most general dental offices. Or cleanings maybe not as good. When I see the patient for a quick consult and they just had a cleaning and there's still some calculus. And the number one complaint I hear, and you can let me know if you've come across this, they say, Horton, I agree with you 100%. We should be doing better, but
Mhm.
we're only given an hour, and in that hour, we got to take X-rays, we got to chart, we got to do the cleaning, oral hygiene instruction, and the doctor has to come in to do the exam.
Yeah.
And we fought for more time. They don't give us more time. And I remember I had one of my best hygienists I've ever had. Her name is Sarbjo Alwalia. She was a young hygienist out of California, came up here. We had the best rapport because I told her for every appointment, you decide what you need. When you're making that next appointment, you tell the front, do you need 60 minutes, 75, 90? If you're doing
Wow.
quads, do you
Hmm.
want to do one quad at a time on this particular patient, whereas on another one that might be limited or it's just not as bad, you could do more. She was terrifically happy. And she was happy. My patients were happy, but production did go down a little bit.
Hmm.
But for me, the trade-off was we're providing better care,
Right.
right?
Exactly.
What do you say to the hygienists where when you make critiques, they come to you and they say, well, Dr. Bergman, I 100% agree with you, but my boss will not give me more than 45 minutes to 1 hour to do everything. And I still got to turn over my own rooms. You know, how can you address that? And is that, can we do anything about that? Is that fixable in our industry?
Have an assistant.
There you go. There you go.
Right? I mean, you were just saying everybody needs some help. I agree. We've had over the years, we've changed the way we do our new patient appointments because sometimes hygienists will tell us, like, I just don't feel like I have enough time to do everything, and I don't want to have the patient come back, just have one appointment and then come back for the actual prophy. So we try to listen to the person who has their boots on the ground, or they've got their curette in the mouth. Okay. So we need to give them what they want so they can be successful. And one thing that my dad taught me, he's a retired physician, but he told me when I first went into dentistry, he said, if you take care of your patients, you will not have to worry about your income.
Right.
Just treat your patients right. In my particular practice, we see a lot of TMD patients. So sometimes they can only have one arch done at a time. Sometimes they can only have one quadrant of scaling and root planing. That's all they can tolerate. And yes, that does bring production down. But if all we're thinking about is production, that's not a good thing. And I agreed to that extent with the conversation on LinkedIn that yes, we should not be delegating for the sake of increasing production. I think we should be delegating for efficiency.
Right. Right. No, that's a great way to put it. And I think if you don't mind, I'm going to adopt that into my lexicon is we're delegating for efficiency because that's at the end of the day, there's money to be made, but we all have to sleep at night and we all have different thresholds above which we lose sleep and we don't. Right. And I don't want to pass judgment on that because there's a big gray zone and you go to five dentists, you get five different opinions.
Yeah.
Not anyone is necessarily wrong. I'm going to share another graphic for you because one of the replies I get, I think it's because we're here in the Northwest. When I talk about the financial pressures that a dentist feels in regards to the hygienist, I'm almost always talking to someone that's not from Seattle. When I sold my offices, my highest paid hygienist was $85 an hour.
Wow.
My other one was $80 an hour. I was getting requests for signing bonuses as I was hiring, moving expenses paid, and so forth. That they're removing from a different part of the state or from out of state. And that's where the market is.
Right.
And when I say this, they often don't believe me. And so I want to bring up this graphic because people from out of state feel like I'm making this up. But if this here is a video, a screen grab from Indeed, and I'm going to press play, and you can see all these are job ads from Seattle. $80 an hour, 70 to $90 an hour, 70 to 80, 75 to 77, 70 to 80, 90 to 115.
Yeah.
And right, so I hope people can believe me that we're not just exaggerating for the sake of trying to win an argument up here in the Northwest. There are big budgetary constraints that we have because the overhead is so high. Our assistants are
Right.
making 35 to $45 an hour now with minimal experience. The hygienists are making that much. But our good old friends at Delta Dental and Signal and Regents, they
Mhm.
might still be paying us $70 for that pro fee.
Right.
So that being said, what responsibility as an employee does the hygienist have to say, I want to build a structured schedule to be able to at least pay for me being here if I'm
Mhm.
getting $85 an hour and not unnecessarily burden the practice by losing money? Is that even doable, or are we just in one of those areas where hygiene is for a while either going to be a break even department or a slightly red department, but we needed to keep the other parts driving?
Yeah, I think that's the angst with dentists, because a lot of dentists, I've talked to a few here where I live, it's a little bit lower cost of living, but we're still paying a premium dollar for our staff. And I want my staff to feel compensated for their time, but on the other hand, I want to be able to make a living for myself. And so if everything that I'm doing is just covering overhead, then I think that's when dentists get bitter. And so that's when if they see the hygienists, taking a long break or not really doing anything because their patient didn't show up, it's it leaves a bad taste in their mouth. That what we really hope is that, like, I have a wonderful hygienist. Anytime she can, when she has a few extra minutes, she comes to the front and helps, or she asks me if I can teach her about something like my functional therapy that I think some hygienists are really interested in learning more about. So to be able to always be curious and learning and making your practice healthy and viable, that's what a dentist wants from someone who works for them.
And when in your experience, when you've gotten a new staff member or a new set of staff members, how long does it take to really just get in a rhythm where everyone knows where everyone's at? You can do no look passes, right?
Hmm.
Every day is a score. How long does it take to
Yeah.
get there?
People say that it should take 3 months or 6 months, but I honestly think to get into that really, really good rhythm usually takes a year.
Mm,
I think that like personalities may not mesh that well, or just some people are fast, some people may not be as computer literate, and it takes them longer to write their notes. And I think what from what I've seen, around 6 months, things start to feel a little bit more comfortable. But by the end of a year together, it's like, you probably had assistants when before you ask for the instrument, they're handing it to you.
yep.
And that's when we have efficient practices that I like to say what we're doing is repeatable. We know that we can do this for all the patients. I mean, um, there will be times when there's somebody who needs a little extra hand holding, or they need somebody to listen to them more than someone to actually do treatment. But for the most part, we have our systems in place. We know that the time that we're going to spend is going to be similar, and so we have a little bit of a cushion in case we need it, but for the most part it's just a well-oiled machine where the hygienist finishes what they need to do, the assistant comes in, the hygienist goes to the next person, and the doctor is on a schedule where their exams are, they know when they're going to have their exams. We like to talk about things like that during the morning huddle, So, okay, there's a time right here today where the doctor needs to do the exam first, because if you come to get him or her at 12:30, they're not going to be available. And so that's all about efficiency again, more so than it is about who's holding the Profi cup.
I feel like I'm gonna laugh every time we mention that because it seems like such an odd thing to be fighting about. But so if let's say I could wave a magic wand and all of a sudden insurance is paid what we considered would be a fair amount for treatment, especially preventative treatment. Let's
Mhm,
say magically we got $250 for a prophy. Everybody would be happy, right? Just to throw a
mhm,
hypothetical number up there.
mhm.
Would dentists use, or owning dentists, or even corporate dentists, would they say, okay, we're finally getting paid an adequate amount, so let's ease up the schedule and let's spend more time with our patients? Or would they conversely say, well, hell, let's try and pack them in even more, right? How do you regulate this? What is the magic pill to make everybody happy in this situation?
I don't think there is one. I think that's what makes life so confusing sometimes. My husband and I are a great example. We practice together. My husband's the most laid back, even keel person. Somebody threw a handpiece away one time and he barely blinked over it, where I was like, oh my gosh, what in the world is happening? But he would let his assistants and his hygienists have as much time as they asked for. And he likes a lot of time himself. That's just his temperament. I'm the opposite. I'm like, the patient is here. I need to go. If I'm on the phone, I say, Mom, I gotta go. Bye. I want to stay on schedule. I got that from my dad. He was called the Minute Man in the operating room. And so it's a temperament thing. It's not really something that we can regulate. It's not a policy that we can make. It's going to be how the person who gets to make the rules decides that they're going to handle that new situation.
Right. And that's the difficulty, I think, for me. As much as I want to protect our industry, I have seen a lot of things in our industry that I don't agree with. I've worked in offices that took capitation plans, and I've been a patient at Willamette Dental that had capitation. And I remember going in for my exam and then being said, okay, okay, you need a prophy. It's January. Our first opening is until September, right? Because
Wow.
with capitation, it's you get a steady check every month for every patient on your roster. A lot of the preventive stuff you do is free. So the incentive is to collect the check, but to not see you.
Yeah.
So I've been on that end. I've seen outfits like Seymour Dental, which years ago got busted because as a federally qualified center, they got an encounter fee payment from Medicare. And I remember when I did my externship there, we were not allowed to do fillings two at a time. You could only do one, even if the two teeth were right next to each other, because it was just one encounter fee. And if you split it up, even
Hmm.
though it was inconvenient for the patient, obviously the child and the parent to take off of work to come in, they ended up getting a whistleblower busted them and they got reprimanded for that. So it's hard for me to take a hard line on any side because I understand what the hygienists are saying and I've seen doctors bend rules a lot.
Yeah. I've seen it too. It's very upsetting when you see that.
Yeah. And but I will say, sometimes the tone it just ruins the conversation. And I've seen this in medicine where there's this almost disdain for from mid-level providers towards higher level providers because the mid-level providers feel like they're being overlooked, underappreciated. You know, you ask any nurse or registered nurse how they feel they fit in or if they're appreciated in the network where there is a doctor and a PA and all that, right? And have you experienced that hygienists not out of malice, but they're thrust in that into that mid-level position, and that might affect how they see themselves or how they see us.
Yes, I think what happens, not all hygienists, because again, sometimes it's their character or their personality, but I think what happens is that they think to themselves, I shouldn't have to do that. Okay. Like, no, I don't want assistants doing any of my job. But then the assistant comes in and cleans their instruments or tears down their room, and they're like, oh, okay, you can do that, because who wants to do that stuff, right? Um, and I think that hygienists got really angry at dentists during the pandemic. That's what I experienced personally, was that I don't think they realized, like, for a practice owner, yeah, we were staying home, but we weren't collecting unemployment. You know, there is a big difference in what a dentist's burdens are compared to, like, they go home at the end of the day if something's leaking or something's broken or you have to wait for the repairman. They don't have to do that, so I think it would be nice if we could all understand that, yes, there is it's not a hierarchy, but there are different levels, and mid-level doesn't mean less than. And assistant doesn't mean bottom of the totem pole. It shouldn't. We should all be a team. We should all have the same goal of making the practice successful, the patients first, taking care of the patients, making the practice successful, and having a good time with each other because we spend so much time together. We shouldn't have animosity towards one another. That's what leads to burnout for
Yeah,
all
and
of
you know,
us.
I love how you said that. You know, hierarchy doesn't mean or be the level of provider you are doesn't mean you're lower on the totem pole. And I've almost often thought about it the other way because I can't do anything without the support staff. Like in order for me to be a good doctor, I need a great front office. Need a great financial coordinator. I need an amazing assistant sterilization tech. I need the hygiene team. Um, it's because it's not just the treatment I do in that 30 minutes I'm placing an implant, right? It's the entire experience from when they walk in the door. How easily do they get their insurance verified? When they're set up, is everything laid out properly? Is everything cleaned properly? Has the cleaning been done properly? Has the patient been educated on how to take care of the implant afterwards? So it's definitely I've always seen it as an upside down pyramid, right? The
Mhm.
liability is mostly with the doctors, but I feel the importance really is the team, like you said,
Yeah,
like you said.
100%. When I taught the class that I taught was called Assistant and Team Training. And I let the assistants know that after I trained them, they were going to have the privilege of going back to their practice to teach the rest of their team what they learned. So they could tell the front office, hey, what I learned is that if we schedule in this certain way, it's going to make it easier for everyone to stay on schedule. And that's productivity, So they had the opportunity also to talk about what patients need. Like, patients spend more time with the hygienist and the assistants in most cases than they do with us. So we need to have good communicators, and then sometimes the assistants or the hygienists are like the conduit. So the conversation happens, the doctor says something, the patient sits there and nods their head, And then the doctor walks out of the room and they're like, what did she say? What was she talking about? So the assistants and the hygienists are really important in developing rapport with the patients, the parents of children, patients, they have lots of opportunities to make coming to the dentist not a scary place.
Right. And then one more thing before we close out, because I guess I wouldn't be my full honest self if I didn't bring this up, though. So now that we've expressed our extreme appreciation for all team members, all levels of providers, I'm not good with holding my tongue, and I tend to come off, admittedly, somewhat condescending or sarcastic at times, especially when I feel that someone is experiencing a moment of self-importance that I feel may not necessarily be warranted. So I want to bring up this graphic from the exchange that we had on LinkedIn against the hygienists here. Let me know if you can see it
I
here.
have a feeling I know what this is.
Yeah, and so here we are. And a lot of this is just one of the many replies that I was tagged in because they didn't like what I was saying. My reply literally was like, this is coronal polishing. That's what we're arguing about. Calm down. We've been doing it in Seattle forever. Right. But I'll
Uh-huh.
get these. And if this was just a one off, I'd say, okay, whatever. So this is an individual thing. I would say at least 30+% of the replies have this tone
Yeah.
where we're not just cleaners, which I'll admit, you're not just cleaners. I never said that. Right.
Mm-hmm. Mm-hmm.
And I'll jump to the middle here and read it. It says the reason you're seeing the hygienist is that so that we can save lives. Now, there's nuance to that because they do all go on to say that bacterial deposits are linked to metabolic disorders, ischemic strokes, heart disease, Alzheimer's, all true. But the tone often comes as if, and I'll stop sharing here, as if I'm having a conversation with a combat emergency doctor. Like I get that what we're because hey, I'm a periodontist and you're a dentist that treats TMD, which is extremely nuanced field. Like you have to be a detective of all sorts to be able to treat TMD. And so I applaud what you're doing. And it's important. What I do is important. But I would never get into it with, say, a cardiothoracic surgeon and say, but I'm out here as a periodontist saving lives too. Like I know my place, and I'm happy with my place. I love being a periodontist. I love the benefit I provide patients and the contribution I make to their systemic health.
Mm-hmm.
I just have a hard time accepting that tone of so and so should not be polishing teeth because I'm a lifesaver, and somehow you're going to compromise the lives of these patients by not letting me in the room to polish those teeth. How do you respond to that? Or do you just laugh and say, okay,
Well,
whatever?
what I would say is we all took the CPR course together. So if your patient starts choking, I hope we all know how to do CPR because that's when we're saving lives.
Dude, that is a great response. I love that response. Um, so yeah, I think that's just more of like a personal soapbox is the issue of self-importance. Because again, I love what I do, but I know my place within the grand scheme of true
Yeah.
life saving, right?
I love the humility of I went to OHSU every Thursday for about 3.5 years to the neurosurgery department for research that I was doing with a neurosurgeon, and he is world renowned and he is saving lives, no doubt. But I would walk into the exam room and he would say, I'm just a dumb neurosurgeon. This is the real expert. And every time I would think, wow, that, like, come on. That's
Right.
just such a nice way to be, like, not so. haughty and on, I mean, he's doing one of the hardest things ever, brain surgery. But we can all have a little humility. A little humility goes a long way. And yeah, it does. I'm not going to disagree with you. It does rub me the wrong way sometimes when I hear that tone, because we none of us need to think so highly of ourselves that we can't give a little bit of compliment to, I'm the lowly dentist and he's calling me the real expert in the room.
Right, right, right. So before we end the episode, I'm so glad to have gotten your input on this soapbox moment of mine. I am curious though, in your particular practice, because you're a very niche area of practice when it comes to TMD. A lot of general dentists, even my time as a general dentist, it was the only thing in our toolbox was a night guard. Oh, you got
Mhm,
jaw problems? Night guard, right?
mhm,
You can't
mhm.
open? Night guard. What does your team dynamic look like when you're treating this very, very complicated and mysterious realm of dentistry in patients that have often chronic, life debilitating temporal mandibular disease? What does
Mhm.
your team dynamic look like in your setting?
Well, I think I'm really fortunate because my team is interested and they listen very closely. They've also seen me suffer quite a bit. I've had
Mm.
5 surgeries. I have total joint replacements. They've seen what it is like to suffer with chronic pain. And so they listen when I talk to the patients and they learn. It's kind of train on the job training for them. They also know that it's more important to me that the patient is comfortable. And so if we have to change things a little bit, we do that because we need to keep the patient comfortable. And the other thing they know is that when people are in constant pain, they can be difficult to get along with. And so we have to give them a little extra grace just because I had a patient sit in my chair one time and she just started crying and she said, I know that I'm not fun to be around. And she said, I'm sorry that I spoke sharply with your staff. Um, they didn't deserve that. And my staff, they gave her some grace because they understood she's really, really struggling. So I think that's something that I love about what I do because I know it's not the case everywhere they go. Sometimes they're dismissed, sometimes they're rushed along, sometimes the staff has no idea how to answer their questions and they say, well, you just have to wait for the doctor. But I feel like I've super trained my staff and I'm really proud of them.
That's awesome. I feel like the two areas where I feel I have the most appreciation when doctors work in these areas, it's your pediatric doctors, because God bless them, 'cause I don't want to work on kids. Unless you got that perfect kid, I'd rather pass it on, right? And then the chronic pain patients.
And those are my two favorite types
And
of
those are
patients.
your two favorites. You are doubly blessed and doubly appreciated. Dr. Bergman, thank you so much, Susie, for coming on the show. I'm looking forward to more episodes, especially as we collaborate more.
Yeah.
It can be your topic of choice. Maybe next one we do a slightly more academic one, so that way we can have the dental students listen to it and potentially use that for extra credit, write a report or have a reply to it. But thank you so, so much. You always brighten up my day when I talk to you. Do you have any
Same here.
closing or parting messages for the audience before I do my outro?
Oh, wow. Parting messages, I would say whether you're an assistant, a hygienist, or a dentist, my advice is always the same, and it's to listen to the patient. So if you listen to the patient, they'll tell you what they need, and then you'll be the one who will be able to provide that for them.
Sage words. Thank you so much. So, to all the listeners out there, I appreciate you for tuning in. Got a lot more content coming for you, and then me and Susie will make even more content on top of that. But you always know my parting message: keep reading, keep listening, keep learning. and we'll talk to you soon.